it allows our mind to rest and it allows us to be creative. And as you know, some of the psychologists, Mihai Csikszentmihalyi has written about flow, and the more states of flow we have, the greater joy we may feel and happiness. And that's why art is so important, because it can bring joy and it allows our mind to wander a little bit and just relax.
Yeah. Welcome to the Too Curious MD podcast. I'm Dr. Ali Ahmed.
And I'm Dr. Soraya Khan.
In this podcast, we are asking the unasked questions.
We're physicians applying the lens of narrative medicine, exploring integrative practices and psychedelic treatment in healthcare.
Together with our guests, we weave new learnings from stories, expertise, and the sciences. With the wisdom from holistic, alternative, and these conventional medicines, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in. Welcome to the Too Curious MD podcast, where we ask those unasked questions in ketamine treatment, psychedelic treatment, and narrative medicine, and bringing in all elements of what heals in this space in our health system. And this is the kind of the platform where we meet with other expertise, patients, their stories, and really engage in that space of learning and being curious to the things that we experience in healthcare. So we are happy to have Hisla Bates with us today. Hisla, would you give us a little bit of an intro about yourself and the work and what brings you to the work that you do and how you got to that place?
Yeah, I never know where to start with this. I'll start where I am right now, and that is in private practice. I have a psychiatry practice where I see adults and teens, and I also do art-assisted therapy. I started the Doctor's Art School where physicians can come and where we are creating community to use expressive arts, narrative medicine, graphic medicine, and so on. And that's my way of helping physicians heal from burnout. I'm very interested in the whole burnout situation that's affecting a lot of us. And I feel like if I can help one physician, I can help many patients, because if our physicians aren't well, then healing becomes very difficult for our patients. And so that's kind of my mission. I started out as a fashion designer. I got pushed into fashion design by my art teachers in high school when I was pretty determined to go to medical school, but I got talked out of it when I took a summer course at Parsons School of Design and realized that there was a whole nother world that I didn't even know existed. I never knew existed. And I decided, okay, I think I'll try this thing. So I went to Parsons and graduated, but then I still had this yearning to be a doctor. I really wanted to help people, and it was this altruistic yearning that got me to go back to school and do all of the pre-medical requirements and so on, and go on to medical school. That's been my journey. I trained at Yale for my internship in ophthalmology. I did a year of ophthalmology, and then went to Mount Sinai for general psych, and Harvard for my child and adolescent psychiatry fellowship. And I've been at this for probably 20 something years. Yeah, 25 years.
So
Yeah.
wonderful to meet you, Lisa.
Nice to meet you both.
The part of the story where, my kind of interest was like, you got talked out of medical school to go to art school, to go to fashion school. I love that.
Yeah, my teachers were trying to get me to go to the High School of Art and Design. So this started early on, and I said, no, absolutely not. I want to go to an academic high school because I want to go to medical school. And then I get to high school and I get the same thing. My high school teacher is saying, you absolutely have to go to art school. And I was saying, no, I want to be a doctor. I love chemistry. I love math. And she said, okay, just go to Parsons for the summer. just do it. And so she convinced me and I went, and it kind of changed the trajectory for sure. Yeah.
And I'm curious about how I'm even just imagining a reality in which we have so many intelligences, right? We have so many different kinds of intelligence, right? And because of being caught in this duality of between art and science, one part of you had to wait to be fulfilled, right? Until the other part was. But we can imagine a reality in which both those things can coexist and work together and grow together, right? Like, isn't that how we're supposed to? So it just brings me to the fact of where we have divisions that can create such just choices, right? And sometimes we label ourselves this, oh, I'm this kind of person, so I
Yes.
can't do that. And how concreted that becomes into identity. But here you were kind of like being able to lightly step between those two sides. And what was that like? Like, did you have mentors at the time, or did you have your own personal way of making sure that the creative mind was fed while you were in medicine, and the kind of sciencey mind was fed while it was in the arts? How did you navigate that?
Well, I was pretty focused when I was in, when I was in art school. You had to be. There were 75 of us that were admitted that year, and only 25 of us graduated. Pretty intense, high attrition rate. In some ways, I didn't really think about science, but I met a young woman who was changing careers, and she was about 28 years old, and she said, "Oh, I was in corporate." She was doing something in business of some kind, and she said, "I'm going to medical school." And all of a sudden, I thought, "Oh, wow, you could actually do that? You could you could go to medical school after doing something completely different." Once I discovered that, I was thinking, okay, maybe I ought to try this. And so that's how I got back on board. I also saw a documentary of these people who lived in the southern parts of the United States who were very poor and they had no medical care at all. And most of them were people of color. And I thought, if I have any ability at all to make a difference, I think I need to at least try. And at the time, I had a boyfriend who was a philosopher, a mathematician, and a playwright. And he said, just go for it, and I'll tutor you in physics or math or whatever. And so he really helped me along the way and encouraged me to just go for it. It wasn't an easy decision, especially because I was probably about 28 at the time when I started, 29 when I started medical school. So,
I
yeah,
want
I
to
had
ask, what was more difficult, art school or medical school? Because what you described about Parsons seems like it was really high pressure.
because, you have to meet deadlines and you have to produce a lot
Hmm.
of work. And at the time, I was in the fashion design department. And I was also commuting like an hour each way, which was not easy. And there were very strict rules. At the time, we couldn't wear pants. We couldn't wear pants or jeans. We had to dress a certain way every day. It was very strict. And it was Ann Kagi was the chair of the department, and it was as if it were the 19th all over again. And we had to not only illustrate, I mean, you have to learn how to draw and illustrate fashion and clothing. You had to do textile design. You then had to drape the garments, make the patterns, create the outfits. There were fashion shows and competitions so it was a lot of work and an amazing experience. I have no regrets of doing that first. Yeah, I think it made
Absolutely.
me a better doctor.
I would think I was going to say the same thing. I'm like, that sounds like you learn about teamwork and how to work long, hard hours at a project and kind of have a vision, but also know how to make compromises, right? How to kind of like, yeah, get reviewed and get crushed and come back again and do it better. Like the resilience that builds. That's amazing.
Also there is something called design thinking where you get one outfit. Let's say I take one outfit and then we had to create 50 different outfits from that one outfit. So, you change the neckline, you change the sleeve length, you change the cuff, that helps you to really think creatively and to think quickly. So you're always thinking about what this could be. So when you look at anything, and I do the same thing, whatever I'm faced with, whatever problem I'm faced with, I think about multiple ways in which that problem could be remedied or changed in some way. That's the creative mind.
I'm
Yeah.
going to ask you a question.
Yeah.
I think it goes back to kind of learning and how we learn and the framework that we lay down as we start that learning experience from childhood all the way through adulthood and even later in life, right? And I can resonate with your story very well because I was an engineer before I was a doctor, and I had no plans of being a med doctor at all. Just to do research, stick to the lab, and figure out this stuff was not for me. I know. I was like, oh, no way. And coming around and seeing the human body as a machine is a incredible, fascinating, like what, from that vantage point to this day lives with me. Like I look at now studying the human brain and saying, my God, you can map out the way of thinking. Like your thoughts are mappable. There's a communication network. I mean, and seeing it from that vantage point. But I think what my question is the integration, right, of how we learn and what your thoughts are on why do we have to separate it all out? Why is that necessary? Why is math a math topic? Why is physics a physics? Why isn't it about learning about how a flower grows and seeing it in that way, the colors, the textures, the fluid mechanics, the chlorophyll, the photosynthesis. How can we not see it in that way? What are your thoughts on how we learn and
Yeah.
how we're
I
learning?
love that question.
Well, I
I
think
love that
that
question.
it all comes down to what we value. We're a society in general that values math and science above the arts. And we need both, and we need the integration of all of the topics. And it's the same thing as true with medicine. We separate different parts of the body. I did ophthalmology, but I could have been a cornea specialist, the retina, anterior chamber, neuro-ophthalmology. There are like 7 different types of ophthalmologists, for one body part, which the eye is a pretty incredible organ, but we also separate the bones. I mean, there's a hand doctor and a foot doctor and a knee doctor. And so why is medicine so separate? That is my question. And why are we not thinking in terms of integrating the mind and the body? And why is psychiatry off here and addictions here? And addiction and psychiatry are separate as well. And, it may make some people's lives easier to focus only on one thing, but it makes our lives richer to focus and integrate all of these things. And I'm not sure why that is. I think other cultures are probably better on integrating both, but I think the value is placed on math and science and what we can explain, although I don't think we know the answers most of the time.
And I think it really brings up the question of education as it is even now. And I would even say it's kind of global. The ways of learning have become very global. And there may be some places that have held to the experience of learning in this very imaginative way and kept that imaginative mind available and not discredited it. The child, I was reading about the perfect age of learning. The perfect age of the human being is age 6. That's the perfect age. They have a sense of identity, they have that curiosity, they have a sense of spirituality, they have emotional, and they're so aware. And that 4 to 6, I would say, that magical thinking, that's such a beautiful age. And what happens to it? Where does it go? And as soon as they enter school, everything changes.
Yeah, I think around the age of 8 or so, that's, and Picasso said, every child is born an artist, but somehow that just disappears. And I think it's when we start to compare ourselves and judgment creeps in. That person does it better than I do, so I'm not good at it. And then we decide not to take that risk anymore.
And it's part of that industrialized education system, right?
Yes.
Is what's created that, because that's there's no purpose to that. It doesn't help us learn better. Actually, judging, pairing, grading constantly is a way of shutting down creativity and even that learning impulse. So absolutely.
And
We
what should,
started.
right? You were
Mhm.
told to be an artist, and you were guided in that path.
People saw things in me that I didn't, I mean, I always liked to draw and color as a young child. That is something I did a lot on my own. I was kind of an only child, so that's what I did. I would get these coloring books from America with my
Yeah.
64 Crayola crayons
The
and
big box of
down.
crayons, the 140
Yeah,
colors, where you had 3 shades, 10 shades of pink. In school.
magenta and midnight blue,
My roommate, her parents sent her a box of, I was fascinated.
Of colors.
She has a sharpener too.
sharpening back, the whole thing. Yeah,
We are talking about the ability to lose yourself in
yeah,
hours and hours with absolutely no expectation other than to just have, do what you want, what you absolutely want. And if you love colors and if you love solitude and just that way in which communion, right? You're really in communion with yourself.
yeah,
Because
absolutely.
right? You're playing, you're not planning. There's no like, oh, I'm going to draw a red heart. No.
Yeah, I mean, you get into a state of flow, and that state of flow is really, it's important. It allows our mind to rest and it allows us to be creative. And as some of the psychologists, Mihai Csikszentmihalyi has written
Mm,
about flow, and the more states of flow we have, the greater joy we may feel and happiness. And that's why art is so important, because it can bring joy and it allows our mind to wander a little bit and just relax.
yeah.
In your
And,
school,
and
in what do you learn about the people that come, the doctors that in your program? What changes as they kind of learn this way of expression or art?
Well, I'm really working with the first cohort right now, and we're in week 2.
Okay, week 2.
We're pretty early on.
yeah, awesome.
And for our last session, because, we talk about our first session, we talked about the disconnect between the mind and the body and how a lot of us have shut down ourselves and are disconnected. And in medical school, how we're taught to not go to the bathroom when we need to and to just keep working. You're in a 12-hour surgery. You're not going to move. You're not going to go anywhere. You're not going to eat. We grab a donut, and we don't drink enough water and we don't take care of ourselves because the patient comes first. And that leads to our being very disconnected from our bodies and we don't listen to our bodies anymore. And so I ask people to draw what that disconnect looks like. Is your head separate from your body? And what is your head saying to your body? My body was saying, you don't exercise me enough. You need to move. You need to move more or whatever. And what's my head saying? I don't have time. I don't feel like going to the gym. I don't feel like walking. I don't feel like putting on a heavy coat. We make all these excuses. And so how can we merge those two? So the Doctor's Art School, I mean, a lot of the stuff comes out of um, my head, how do I create these concepts visually? And how can others create these stories visually? And graphic medicine is also a movement where people are expressing themselves through cartoons to talk about illness, to talk about mental health, or experience being a resident or a medical student using cartoons. And so I'm bringing in poetry, literature, narrative medicine, and visual storytelling and merging them in this concept of the Doctor's Art School. I am hoping that more doctors will be open to it because the basic reason for this is really about forming community and forming a safe place where we can actually not only talk, but draw together. And the very last session I did with them, the people who were drawing stick figures, I showed them how you could actually do facial expressions and draw a face and draw a body instead of a stick figure. And that was for one person who'd never drawn before, that was a revelation. It's like I didn't think I could draw something and now I can. So you're moving from a very fixed mindset to a growth mindset where you're just expanding your mind, you're expanding your ability, expanding your imagination, and really learning to create and think differently. So that's what I'm hoping they'll get out of it.
That's amazing. I want to go there. No, I love
Yeah.
that because the visual metaphor, right? I really think what we're doing here is yeah, like just capability, just connection, and then expressing those things that are just hard to express, being at that edge and you're really playing with neuroplasticity. I love how you brought up growth mindset as well. It's yeah, we get into fixed mindset. The only way to get out of that is to like, yeah, challenge yourself. Yeah, get uncomfortable going, yeah, my drawing's not very good. Nobody's is.
Yeah.
Nobody's is.
I mean, there's always going to be somebody better than you.
Yeah.
I strive to be better. I'm not the greatest either, but that's not the purpose of it. The purpose is really the experience of it all. Yeah.
I love how in middle school, because I'm a medical educator as well, and the middle school had started to talk about growth mindset and fixed mindset and this ability to fail, right? That
Oh, yeah.
needed to happen and normalizing it. So there were these teachers who were talking about it. Meanwhile, and this is how both hands don't talk to each other, then they're bringing in into K through 12, like all of this evaluation, this constant testing and everything. And so, yeah, we need to learn that, but unfortunately, it's gonna put you in fixed mindset, if you're constantly just testing, testing, testing. And I was very kind of and looking at that in medicine where fear of failure is really baked into our training, right? Like that judgment is huge.
Yeah, I always say, when you're staring at a blank canvas or a blank page, that you're facing uncertainty every time. And no matter what we imagine our drawing to look like when we're finished, it never looks that way. So there has to be an acceptance of imperfection, an acceptance that things are not always going to turn out the way you want them to. So drawing and art becomes a metaphor for life.
It's interesting,
Deep,
both
deep
Soraya
acceptance.
and my daughter are also artists and went to art school, got into Parsons, and my daughter, but she didn't go because I was like, well, you need to go to 4-year college, which I regret because she really is an artist, and she's that artist that still feels her work is incomplete and never signs her work. And I'm always like, why don't you sign your work? It's never complete, right? That's what she says. It's just not complete. It's just not there. It's not what maybe, like you said, she imagined. And I think we do this talk. This is our self-talk of ourselves and how we see ourselves in what we express, which I find is kind of a place of, maybe a place to kind of open up and say, hey, what's with that? And like with your students as they come in, what is it about what they express even that shows up that they didn't see, or somebody else sees, and there's a perception of what's shared on that page. And I find that that's beautiful place of.
Yeah.
I love that. We used to do this, this is how I got into art and medicine, was as a medical educator taking on a medical humanities course to design it, this kind of observation exercise that we would go to the Modern Art Museum and, and have these exercises where you're standing around a piece of modern art and all of us are just standing there and looking at it and interpreting, right? Just that active interpretation. And how much that is exactly what we're doing in the hospital, right? Around a bedside, around a case, there's a pattern that's emerging and everybody has a piece of it. So it became a great way to kind of teach about ambiguity, about respecting each other's perspectives and opinions, and really recognizing like what we bring to the interaction is what we're going to see also, right? So there's just this idea that when we're looking at a patient and, in the Western materialist mindset where we say this is that and nothing else, we've just shut that story down. And, when, let's say, we have conflict around a certain story in the Western medical model, there's also, there's always this kind of competition amongst who's right. There's the dialogue is really about, well, who's accurate, who's right. And instead of saying, well, this is a complex situation. There's multiple perspectives, including the patient's perspective. In the Western medical model, what we've done is just objectified the patient and everybody's standing around opining versus what's the patient's perspective and how can we hold that? Just art even as a teaching tool for these observation exercises, for these ways of looking and these qualities that you want to cultivate in just the practice of medicine, to me seems like very untapped resource. Yeah, I don't know
There,
if you could speak to that.
there are programs, at Harvard and Yale have had for a long time based on observation, going to art museums and so on. And it is very helpful. Research shows that the ones who did the observation but also took an art course were better diagnosticians. And so the observation is important because I think it makes you a better physician. We have to observe and notice subtle changes. And I think because I draw, I notice subtlety. I notice every little change, every asymmetry in a face or body, the way people stand or walk. Because if you have to draw something, you notice it in a way that you didn't before. An apple. You'll never look at an apple the same way if you try to draw it. You'll notice it has 20 colors and it's got bumps and grooves. And yeah, so you have a greater appreciation. It's a meditative process
I
that can
love
be
that.
learned.
I love that. And, we're going back to even medical training, right? Where when we first learn to take care of our patients, observation is the first piece that we're taught, right? It's just, even as you enter the room, just take it all in, right? And the more you can be silent and silence your own self, you can be more open to what's there instead of trying to figure out or label it or come in with preconceived notions even, right? Like how many times have we done that? It's easy to get into that. It's like, oh, I read the chart. I know what to expect. This is going to be a 5-minute visit. And you walk in and you're like, wait a second, something's off. Let me see what it is. And then you just kind of get silent. And there is a moment of where observation and developing that observation capacity. So I'm really excited for Doctors Art School to even just kind of bring people to recognize that we have this innate observation capacity that we can cultivate, right? Like that's what we're talking about here. That's beautiful.
Yeah. I also think it's self-care too. It's really taking care of yourself and noticing yourself and getting outside of your comfort zone a little bit and, connecting with people. The way I was able to get back into the arts, because I completely dismissed it in order to get through medical school and residency and being an attending and a parent, I thought, I have no time. I can't do this. And I started buying art instead of making art. And I discovered this community in my neighborhood where there were 10 artists that would get together once a week. And I joined this group, and once a week, for most weeks, I couldn't do it every week, I took the 2 or 3 hours and started creating art. And it was all new for me, but it changed my life, and I realized this is what was missing. This was what was missing. I was pretty miserable and unhappy.
I love that because when you kind of do that, when you kind of abandon a part of yourself, you're kind of testing it too, because does it call me back?
Yelling, it was like,
Yeah.
try to do this. It was such a strong yearning. I mean, I always give this
How
example.
did you notice that yell? I mean, what was it that it was yelling? Where
So
was it coming from?
I was in Arizona at the time, and I was buying art of this artist that whose name slips my mind right now, but she painted these red dogs, and I thought, wow, those are so cool. And then she did this motif for houses, and I have this, I don't know, I love real estate, I love houses, and the house motif is something that I really like. So it was this really large painting that she'd done, and it was this house motif, multiple houses on it. And I loved it, wanted to buy it. It was $10,000. And my daughter, who's 9 years old, said, Mom, I think you can do that. She's like, don't buy it. I think you can paint it. And so I literally went home and I made a smaller version of it, and I could paint it. And so then I started thinking about, well, maybe I should do this, but I didn't know how I would get started or anything. And then someone told me about this group, and it was in Brookline, Massachusetts. And one thing led to another. I started printmaking. I knew nothing about printmaking, and that's what they did in the group, and painting with oils. I didn't even know how to mix the paints. It was all new to me. And then I started showing my work and selling my work and entering juried shows and showing in galleries. I mean, it was just like I just started, hey, what I'm going to try this. So there's a juried show. Yeah, I'm going to sign up. I'm going to go. And I don't know, it just it was when I started talking to people about my work, I realized, wow, this is powerful stuff because you can communicate. I did this triptych about valley fever, and people would ask me about these triptych, and which are just 3 self-portraits that I did in a row when I had valley fever. And people would talk to me, and I would be able to educate them around valley fever. And I thought, wow, this art thing could be a real educational tool. It helps me to communicate and meet people, and people are buying my work because they're emotionally moved by it. And then when you sell it, it's like that feels really good. So I started to feel really good. And there's a German couple who came in and wanted to buy a piece of mine, and they couldn't afford it. It was this bridge behind me. It was a smaller version of it. And so I gave it to them and I said, just pay it forward. 6 years later, they DM'd me and they said, we still have your painting. It's in our living room. We're in Germany. We want to pay it forward. What charity do you want us to donate to? That was like 6 years later. I mean, when you can connect with someone in that way, it's powerful. So that's what I want
Wow.
to share with other people.
Oh, wow. That's medicine. That's medicine, right? That's your
To something that has carries so much weight and connection in so many different ways. We can't even see it at the time until we do.
And it's a connection to the heart. I really think these images, when we resonate with an image, it's like you're being pulled to it and there's
Yeah.
something in it for you. And I
Yeah.
love that about art, to be something that you can relate to over time. And as you change, it changes for you, right? So it's not just a thing, it's actually a relationship, and it's beautiful.
It is a relationship. And it's no accident that the word art is in the word heart.
There's no such thing as an accident.
I love that.
Things are not by chance. I think I would also highlight what you said, Surya, about, I know you've said this before, the danger of a single story, right?
Yes.
When we see art and even writings, and the danger of really seeing it in one way, and how that takes away from the experience. But what I brings up my curious mind is, well, if everything is a different version of the same thing, then what is it, the thing that we're, I mean, like if you watch movies, and Rashomon, I think, is the movie that talks about the scene, and it's a Japanese movie, and there's a death or the murder in the forest, and there's all these different witnesses, but they present their story of what was observed, and it's all different. The story is different 7 ways. So what's the real story? What really does happen? So
Brings us to that element of how we co-create our reality, right?
yeah.
Yeah. I mean, it's like, what is reality? It's very personal.
Yeah. And even in
Yeah.
medicine, when we tell the story of the patient, we think we know that story, and we don't. And what is the real story from all the different versions of that experience?
Yeah. And the same thing, when it comes to art, I mean, I might draw a flower and you'll draw the same flower and it'll look completely different. And it's what we see.
Yeah. And how like that training can be so helpful when we're training in medicine, to not get stuck on your own ideas and your own biases. I remember and we'll wrap up soon, but I remember a chief resident of ours getting everybody to, he was describing a picture, but he was just describing it to everybody in the room, and everybody drew their version of it. And just that awareness that we all have of our perceptive lenses being so different, that we've got to investigate them. We've got to become familiar with them, and we've got to also be able to have the ability to share them.
Yeah.
And the visual arts are so powerful for that. Well, this has been an absolute treat, Isla. Thank you so, so much for the deep dive into medicine and art and the heart, and just the journeys of being physicians. I feel like in today's conversation, we expanded what it means to be a physician in society, when you really try to imagine the full scope of what that looks like, and how beautiful and well thought out it can be. I really am brought to this idea that we create the beauty that we want to see in the world, and we do it with this kind of love and intelligence that I think we've had on display here today. So thank you so, so much for this lovely conversation.
Well, thank you so much for having me. I appreciate all of you.
Yeah, the unasked questions about things that are happening in healthcare that you feel could be different.
There's a lot in healthcare I feel could be different. I feel very strongly about the doctor-patient relationship and how we can improve that. I'm very passionate about that as well because, I'm not loving the direction that things are going in.
Yeah.
And, I think we're losing the humanity in medicine. And that's also why I do what I do, is because I do think it brings back the humanity that's missing. And what you do as well, with writing. And it's so important that we connect as human beings, because one day we'll all be patients. And, it's just something we need to pay attention to, how we treat other people.
That's so true.
Yeah, absolutely.
I think for the doctor, it's always hardest to be the patient. And I've been the patient, as we probably all have been a patient in some form or fashion. Yeah, the things in that, what we can learn from patients too, in their creative expressions.
Yeah, they're just like us.
And being
A little black humor just to get the day, dark medical humor to get it going.
Yeah.
Lovely to be in the trenches with you.
Looking forward to meeting you both as well.
Be there myself.
Thank you so much.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.